Thanks everybody for joining us today. Really appreciate you being here. We have a wonderful presentation. Couple of housekeeping things before we get started. This meeting is being recorded just so people have access to it after the fact. We're going to be able to share that on our website as well. Everybody's mics and cameras are off, but we do have the chat open. So if you're so inclined to do so, if you want to chat, how you heard about us, where you're from, what you're looking to get out of today's session. And then we're also going to take questions there. So if you want to type something in the chat, as you think of it, we will be able to save those for the end of the presentation and take some of those questions. So I think that's it. Without further ado, I want to introduce Dr. Seedor, who is going to talk to us today about protecting ourselves from the summer sun. So take it away. Thanks so much for being here today.
Yeah, thank you for having me. So my name's Rino Seedor. I'm a melanoma and skin cancer medical oncologist at Jefferson in Center City. And today I'll be talking about protecting yourself from the summer sun, what you need to know about skin cancer screening and prevention. Here we go. And so we're going to cover topics such as what is skin cancer, signs, symptoms, and risk factors, screening, prevention, and sun protection, and just a few slides on some research advances in skin cancer going on. And so what exactly is cancer? So cancer occurs when there is uncontrolled growth of the cells in your body. And there are many, many different types of cancer, and it can develop anywhere in the body. Each type of cancer differs in how it grows, spreads, and reacts to treatment. And cancer is the second leading cause of death in the United States, with about 2 million new cancer diagnoses each year. And so skin cancer, each cancer has a ribbon color, and skin cancer is the black ribbon. So what is skin cancer? So skin cancer is, as you can think of from the name, it is a cancer of the skin cells. And so there are 3 primary skin cancers that we think of, although there are a few more rare skin cancers. But the most common ones we think about are squamous cell carcinoma of the skin, basal cell carcinoma of the skin, and melanoma of the skin. So these are 3 types of cancers that start on your skin, and they are very, very common in the population. Skin cancers in general are the most common cancer in the United States. 1 in 5 Americans will develop a skin cancer by age 70. And most of these skin cancers are detected, when they're detected early, have a very, very good outcome. And even melanoma, which of the 3 different skin cancers is the more aggressive skin cancer, the survival rate is very, very high when detected early. And so what are some risk factors, signs, and symptoms of skin cancers? So starting off, what is a risk factor? A risk factor is anything that raises your risk of getting skin cancer. Anyone can get skin cancer, but people with certain characteristics are at greater risk of skin cancers. In particular, people with lighter skin, lighter hair, eye color tend to be more at risk. Skin that burns, freckles, reddens easily, or becomes painful in the sun. Having a large number of moles can be a risk factor. Family or personal history of skin cancer can be a risk for another skin cancer. Older age and weakened immune system are other risk factors to develop skin cancer. There are certain risk factors that you can change to reduce your likelihood of getting cancer, not just skin cancer, but different types of cancers. For skin cancer in particular, UV exposure or sun damage is very well known to be the main reason why patients develop skin cancer. And so protecting yourself from UV exposure from the sun or tanning bed is key to preventing skin cancer. Other cancers are linked to HPV, the herpes polyomavirus exposure and infection. So there is now an HPV vaccine to help prevent HPV-related cancers. Smoking is a very well-known risk factor that can increase your risk of things like lung cancer and oral cancers and other cancers. And so there are certain risk factors that you can't change, things like your skin tone, and your family history, but there are certain risk factors that you can change that you can focus on to try to reduce your likelihood of getting a cancer. The most important warning sign for a skin cancer is a new spot on your skin or a spot that is changing in size, shape, or color. Another important sign of skin cancer is a spot on your skin that looks different from all of the other spots on your skin. And so I always call this the ugly duckling sign, something on your skin that does not look like the rest of your skin lesions. Because many of us have skin lesions, whether it's freckles, whether it's moles, whether it's changes from the sun, but usually they look similar to each other. But if there is something that really stands out or is changing, that is a reason to go see a dermatologist or a skin doctor. But we think of the A, B, C, D, E's of early detection. A is asymmetry. When you have a skin lesion that is perfectly circular or symmetrical, that tends to be a benign or a non-cancerous lesion. But if there is a skin lesion that is asymmetrical in shape, looks irregular, it's not a perfect circle, that's something that you should have it checked out by a skin doctor or dermatologist. B is for border. The borders of your skin lesions should have an even edge. If the edges are blurry or jagged, that tends to be a reason to go see the dermatologist. Color, usually your skin lesions are one shade in color. It's one shade of brown, one shade of black, one shade of red. But if that skin lesion has multiple different colors within it, that may be a reason to see a skin doctor. Diameter, most of your lesions, pigmented or colored lesions on your skin, tend to be smaller than 6 millimeters. So that's about the size of a pencil top eraser. But if it's much larger than that, that would be a reason to have your skin doctor check it out. And then E is the most important. I emphasize this to all of my patients. E, or evolution or change. So if you have something on your skin that is changing, whether in shape, size, texture, if it suddenly becomes itchy or bleeds, that any kind of change over time of a skin lesion is suspicious and should be seen by a skin doctor or a dermatologist. So again, skin cancers can look very different from one person to another. And even within the same person, one skin cancer may look different from another. So again, very important to just know your own body. Look at your own body now to see what your skin lesions look like, what pigments you have, what moles and freckles you have, so that you know when something changes and something doesn't look normal to you. And so on the bottom, on the left, is a dark raised melanoma with irregular borders. In the middle is another skin cancer called basal cell carcinoma. And then on the right is another skin cancer called squamous cell carcinoma. So all of these look abnormal and are reasons to see a dermatologist. And so we can screen for skin cancer with a visual examination. So unlike other cancers, such as colon cancer or breast or other cancers that are inside you, skin cancers are easy to find because we can see them with our own eyes. So going to the dermatologist or seeing your primary care doctor for a skin check once a year is it's a good way to screen for skin cancer. And then regularly looking at your own skin can be very, very helpful as well. And so how do you do a self skin check? So it's helpful to be in a room that is well lit. It's helpful if you do have a full length mirror, but if you don't, at least have a large enough mirror that you can easily look at yourself in. And it also helps to have a handheld mirror to look at areas that are hard to see. And so things like your back, behind your thighs, behind your knees, those may be hard to see with just looking at a mirror. So using a handheld mirror to look at those areas that are hard to see may be helpful. And then having someone else look at your skin, especially things like your back, is very, very helpful because it's hard for yourself to look at. And so your spouse or your partner or friend could just look at your back and make sure that there's nothing obviously different. And how often should you do a skin check? There's no set rule. You don't have to do it every single day. But certainly if you're coming out of the shower, glance at your skin at least once a week, I think would be helpful to just keep an eye on things that may be changing. And why do we screen for skin cancer? Because we know that detecting a skin cancer early and taking care of it and treating it early makes a big difference and saves lives. And so when we can detect a cancer early before it grows and spreads, treatments are much, much more effective. If the skin cancers are found in early stages, we often just cut them off and we're done with it. If it's slightly larger, more complicated, then we're talking about things like radiation or immunotherapy or chemotherapy. But regardless of what treatment we're talking about, earlier stages, meaning smaller cancers, cancers that haven't spread, are much easier to treat and more likely for patients to not have recurrences. And so early detection can save lives. There are many different Jefferson Cancer Center locations. And so you can easily find a location near you by looking online. There is a QR code there that you could scan to see what Jefferson Cancer Center is close to you. And we also have a mobile screening van that goes into the community to offer free cancer screening for those who otherwise may not have access to them. And so with our mobile screening van, we offer screening for things like prostate cancer, breast cancer, cervical cancer, head and neck cancer, and then skin cancer. And so if you're interested in learning more about the mobile van, there's a QR code there. You can also email the SKCC screening van at jefferson.edu to schedule the van at a community event, or visit our website to see where the van will be next. And we talked about screening, going to your dermatologist or your doctor or looking at your own skin, but what else can you do to protect your skin? And so sunscreen is key to protecting your skin from skin cancers. And so using sunscreen consistently and reapplying is key. And so patients always ask me, which sunscreen do you recommend? Do you recommend this brand or that brand, chemical or mineral? I say, honestly, find a sunscreen that you like, that you don't mind applying often, because that is the key. You want a sunscreen that you're going to consistently apply and reapply if you're going to be out in the sun for a long period. And SPF wise, we always say sunscreen of SPF 30 or higher. You don't, now I tend to use 30 and 50. You don't have to go to SPF 100 or the high SPFs. You can if you want, but the higher SPF you go, it tends to be harder to apply and harder to remove. And so that may be discouraging to reapply and use it often. Reapplying is very important if you're going to be out in the sun for a very long period. So if you're going to be out for more than 2 hours, you should be reapplying after that 2-hour mark. Or if you're swimming, sweating and exercising, toweling off, you should reapply after those as well. And then please check your sunscreen's expiration date. Sunscreens do expire. And so make sure you're using sunscreens that have not expired, because the ingredients that are used in there can become less effective. When you're outside, seek shade when possible. If you're going to be on the beach, bring a beach umbrella, or now they have cabanas that you can easily set up. Avoid the sun when the UV rays are the strongest, usually between 10 a.m. and 4 p.m. Cover your skin with long-sleeved shirts and pants. Wear hats and sunglasses to protect your face and your eyes. People ask me about the UV protection shirts and all these different things that they sell now. I think those are helpful, especially if you don't want to have to reapply the sunscreen all the time to your arms or to certain parts of your body. Then if you can keep it covered, then that would be another way to protect yourself from the sun. Avoid sunbathing, avoid tanning beds and sun lamps. Those can all cause UV damage to your skin and lead to skin cancers. And it's never too late to start protecting your skin. So I have a lot of older patients who said that when they were younger, they didn't know about sunscreen, that they use tanning beds, and so now they feel like it's too late. But it's not too late. Yes, the sun damage that happened when you were younger is not something you can reverse, but certainly we hope that you're going to live decades and longer. And so protecting yourself now is still important. And then I do want to talk about a new ingredient that the FDA recently approved for sunscreen in the United States. And so there has been an ingredient called, I'm going to probably butcher it, bemodifenol. But it's an ingredient that's been used in sunscreen in Europe, in Asia for many, many years. But it had not been approved in the US, the US FDA. The US FDA is very, very strict, which can be a good thing in approving ingredients, improving chemicals to be used in certain things. But they have finally, after 20 years, they've approved this ingredient to be used in our sunscreen in the US. And so this was very recent, as you can see, June 9, 2026. So there are not a lot of US products out there yet with this new active ingredient, but I think we're going to see a lot more being produced over the counter. And so why is this this ingredient exciting? It's exciting because, like I said, it's been used for decades in other countries and it's been proven safe. And I like this ingredient because it protects against both UVA and UVB. So there's different UV rays that can cause skin cancers. And some of the sunscreen products that we use in the US now are good for UVA, but not UVB, and vice versa. But this ingredient is good for both UVA and UVB protection. And also it supposedly, I have not personally been using this ingredient, but supposedly this ingredient has good protection, but doesn't have that kind of a white coating that you get with some of the other sunscreens. So you will be seeing this in more products going forward. What other lifestyle changes that can help reduce your risk of cancer? Not necessarily skin cancer, but different lifestyle changes that can be helpful are improving your diet. And so there's not a specific diet that we know prevents cancer, but eating a good diet is helpful. So in eating fruits and vegetables, fiber, less red meat and processed meats can be a healthy way to reduce your risk of cancer, maintaining a healthy weight and exercising regularly, stopping smoking, reducing alcohol consumption, or other ways that you can actively reduce your risk of cancer. And then the last thing I wanted to cover is just a few research advances that we've had in skin cancer and in cancer actually kind of in general. And so 4 that I'm going to briefly cover. The first thing is called immunotherapy. And so many of us know about chemotherapy. Chemotherapy is a drug that kills cancer cells, but also doesn't discriminate. It kills normal cells in your body as well, which is why you get the side effects that you've heard about or seen in the TV and movies, the losing of the hair, the nausea, the vomiting, the diarrhea, the feeling so terrible because your own body cells are being killed by chemotherapy as well. Well, now there's a category of medications called immunotherapy. These are medications that essentially boost your immune system. So it helps your own immune system recognize and fight cancers because you have an immune system. You have immune cells that are out in your body looking to kill cancer cells, but also bacteria and other things in your body and protect your body. But these cancer cells are very smart in that they hide from your own immune system. They put a brake on your immune system so that the immune system can't activate when you have cancer. And so we have now developed drugs to essentially take that brake off the immune system so that the immune system can fully activate and fight and find cancer. And so specifically in skin cancer, melanoma, which is a type of skin cancer, there's been 2 immunotherapy drugs that we now use together called nivolumab and ipilimumab. Using these 2 drugs together has led to a 10-year survival rate of 43%, close to 50%, whereas before it was 10%. So patients who come to me with newly diagnosed metastatic melanoma, so melanoma skin cancer that has spread throughout their body, their brain, their lungs, their liver, before when they were first diagnosed with the chemotherapy drugs that we were using, less than 10% of patients were alive at 10 years out. So most patients lived 6 months, a year with chemotherapy. But now I have patients who, since they were diagnosed with widespread melanoma, received immunotherapy treatment, and 10 years out, they're alive and doing well. And so we've really come a long way with this new category of medication called immunotherapy, which is very exciting. And now there are 14 different immunotherapy drugs approved across more than 20 different cancer types. And so essentially, any cancer that is out that we have now, we are using immunotherapy drugs, and they have been very effective. The other thing I want to talk about is something called a personalized cancer vaccine. And so we've been trying to develop vaccines for cancer against cancer for a really long time. So if you think about the flu vaccine, the COVID vaccine, these are different treatments that are given to you to prepare your body to find and fight those infections, whether it's the flu or COVID, trying to prime your immune system, trying to help your immune system learn about whether it's COVID or flu, so that when you do catch it, the body can effectively fight it. But we've been trying to develop a vaccine for cancer for decades and decades, and we haven't been able to successfully create one. But due to the COVID pandemic, we've come a long way with developing vaccines in general and becoming very successful with developing vaccines. And using that technology, we are now designing cancer vaccines, personalized cancer vaccines to fight your own cancer. And so how it works is that a scientist will take your specific tumor's unique genetic mutations and create a custom vaccine that teaches your immune system to attack those specific cancer cells so that it doesn't ever come back. And so in melanoma, there's no FDA-approved cancer vaccine yet, but in melanoma, we are pretty close, hopefully in the next couple of years, to have an approved cancer vaccine, personalized cancer vaccine for melanoma. So that's very exciting. The third thing I'll talk about is something called tumor-infiltrating lymphocyte therapy, which is a newly approved treatment for melanoma, for metastatic or advanced melanoma. It was approved in the US in 2024 for melanoma, and I'm hoping it'll be approved for other cancers in the future. This treatment takes your tumor, you cut out your tumor, and then we take your immune cells directly out of your tumor. We grow billions and billions of those immune cells in the laboratory and then give them back to you. So what we think is happening is that, like I said, the cancers are very smart and they hide from your immune system. But we have found that if we cut out some of your tumor, there are some immune cells that have made their way into the tumor. There are some immune cells that found your tumor and are inside your tumor. But perhaps there's not enough of them that made it and found your tumor, which is why they lose the battle to your tumor. When I say tumor, sorry, cancer. And so what we're doing is that we're actually taking out those cancer immune cells that are the good immune cells that found their cancer. And we actually take them out, clone them, make billions and billions of them in a laboratory, and then we give it back to you, back to your body, so that these are the immune cells that know what your tumor, what your cancer looks like, and go back and fights it. And so this is a treatment that's been approved in 2024 for melanoma. We're using it now, and it's been very exciting. The last thing I'll mention is AI. So artificial intelligence, we're seeing it pop up everywhere, but we are trying to figure out how to use AI, artificial intelligence, to our benefit in treating and detecting and treating skin cancers. And so artificial intelligence is being developed to help detect skin cancer earlier. There are different smartphone apps, there's different products being investigated using AI to help detect skin cancer, to help understand a patient's skin cancer better, to help better treat it. So there are different apps, I think, already out there, different products, but they are not they are not a replacement for a dermatologist evaluation. So if there is a skin lesion that you're worried about, or you need a skin examination, you should still go to your dermatologist. These are still in production. These are still being tested. These are not a replacement for your dermatologist. But I just want to mention that there is some exciting work out there that this could be very helpful in the future. And so they're looking at different AI systems to analyze a photo of a skin lesion. And so if you take a picture, this is in the future, potentially taking a picture of a skin lesion that you're worried about, uploading it into a smartphone app or some kind of AI system, and then they can help tell you whether this is a skin cancer or this is something that you should be worried about. And this would especially be helpful in areas that have few dermatologists. I mean, we all know how hard it is to get into a dermatology office sometimes because of how booked they are. And so things like this could be potentially very helpful in the future. And so something to look out for. But again, not ready for prime time yet. Please go see your dermatologist if there's something you're worried about. And the other thing I'll mention is that there is a lot of research that is being done at Jefferson, at different institutions to help with skin cancer. And so at Jefferson, specifically, we have something called the Melanoma Research Institute of Excellence. It is an organization, a program that specifically focuses on better prevention, diagnosis, and treatment strategies for melanoma patients. And so they're trying to expand the depth and breadth of melanoma research through grants and awards, clinical trials, different conferences for patients, for clinicians, and caregivers. And so if you're interested in learning more about the MRIE, there is the QR code for that. And so in summary, what can I do for skin cancers? What should I know about? So it's important to know the signs and symptoms of skin cancer to look out for, get checked regularly by a doctor, do regular skin self-checks, protect your skin from UV exposure with sunscreen and sun protection, and stay healthy, reduce cancer risk with daily lifestyle changes, such as eating healthy, exercising, smoking and alcohol, reducing smoking and alcohol. So now I'll open it up to see if there's any questions. If you wanted to reach out to me with any questions, my email is listed there. The email to the Office of Community Outreach and Engagement at Sydney Kimmel is also on there. And there's a QR code if you want to learn more about cancer screening. So I can stop sharing there.
This is great. This is wonderful information. We have the one question in the chat, but I know you already went over it. Every sunscreen makes my husband's skin itch. So any suggestions? It sounds like just whatever works best for each individual.
Yeah, and they do make products that are particularly for sensitive skin. And so it is kind of a game of trying to find what works for you. Like I have a 3 and a 5-year-old, and both of them have pretty bad eczema and pretty bad sensitive skin. And so we just try different products to see what product doesn't make them itch or what product doesn't make them break out. And it's interesting because one year, if a product worked, doesn't necessarily mean that next year the product doesn't irritate them the next year. And so it is every year kind of trying to figure out what works for them as their young skin changes. But yeah, find what works for you. Try different products. There are very skin sensitive products out there you just have to try different ones.
Does anybody else have questions? Feel free to put them in the chat. We have certainly enough time. While people are thinking on that, I have a question. So I know you talked about basal cell, melanoma. Are they all kind of separate things, or if is a basal cell, if left untreated, does that then turn into melanoma eventually, or what does that look like?
Yeah, so that's a great question. So those are 3 different skin cancers, and
Okay.
so your skin is made up of different cells. And so different cells, when they mutate and become cancer cells, become different cancers. And so a basal cell cannot turn into a melanoma. A melanoma cannot turn into a basal cell or squamous cell. They're just 3 different cancers, but they're all skin cancers. They're all cancers that start from your skin and are all from UV exposure and sun damage. I will say out of the different types of skin cancers, basal cells and squamous cells are the most common and tend to be very slow growing, and they don't tend to spread. Whereas melanomas can be a little bit more sneaky and aggressive. And so you'll you'll see that if you're diagnosed with a basal cell or squamous cell, the dermatologist will kind of cut them off and you'll be done. Whereas if you have a melanoma, then you may see someone like myself, medical oncology, you may see a surgeon. It may be a little bit more of a workup to make sure that we get all of that melanoma out.
That makes sense.
Anything else?
Anybody, any other questions? We have time in the chat. Um, what if people already got burned and they are dealing with blisters and all that terrible stuff? What advice do you have for them besides don't do it again? Stay out of
Yeah,
the sun.
exactly. Don't do yeah, I mean, the things that have already happened, you can't go back and change, but you can change what you can do today and going forward.
Yeah.
So protect yourself now, start making changes now, because the damage earlier on, you can still compound to that. You can still add on damage to that, and that's what you want to prevent.
Yeah.
Um, there's a question, what populations are more at risk for skin cancers? Color of the skin, age, or anything? So that's another great question. And so people with fair skin, so light skin, blonde, blue eyes, the ancestry, like European ancestry, those patients tend to have more fair skin that tend to become easily damaged by UV damage, which you'll see skin peeling, burning, etc. Those patients tend to be a little bit more at risk for skin cancers. But African Americans, Hispanic patients, Asian patients, even darker colored skin can develop melanomas. That's a very common misnomer that African American patients or Hispanic patients can't get skin cancers. That's not true. You can still get sunburns. You can still get skin cancer. So please still protect your skin. It is much more rare to get skin cancers, but it can happen. It is still very important to protect your skin. And so don't go tanning, protect your skin, etc. Is this all another question, Papa?
Yep. Two more.
I put on sunscreen every morning, but don't put it on again during the day. I try to avoid being outside in the hot sun. Should I put on sunscreen more often? If you're not outside, you don't necessarily have to keep reapplying. But I will say if you're like a truck driver, a delivery driver, you're in the car a lot, I do recommend that you do consider putting on sunblock in areas that are sun exposed, because I have had truck drivers or people who drive a lot of vehicles all the time come in with skin cancers on one arm or one part of the side or head or neck, because they don't realize even in the car, yes, the glass provides some protection, but you are still getting sun exposure constantly while you're driving. And so if you are one of those people to reapply, but if you're going to be inside most of the day, then you don't need to be constantly reapplying every 2 hours. But if you're in a job that does require you to be outside all the time or be close to the sun, then do think about reapplying. And the other thing I wanted to mention, that now there's a lot of different makeup products with SPF, which is great. And so I think a lot of females, if you are going to wear makeup, if you find a makeup product that has some SPF coverage, I think that's one way to make sure you have some SPF on. And then will the spots that dermatologists freeze off turn into a cancer? No. So dermatologists often freeze off either precancers or early stage cancers, and hopefully that takes care of that cancer. Sometimes that, even if you freeze it, it can come back and then become cancer, but freezing it itself should treat precancerous lesions and cancerous lesions. Anything else?
Do you often find, I noticed my daughter's in camp, she's 8 and her scalp will get a little bit red. Is that, when we're spraying sunscreen and stuff in there, is that something that any suggestions on that or do you
Yeah.
see
That's
anything
tough.
there?
I
Yeah.
mean, if your kid will wear a hat, that would be
Yes.
one way to
Right.
protect your scalp. But yeah, the scalp is hard because there is so much hair. I mean, if you have a lot of hair, that means that your scalp is more protected than someone who has very little hair or very thin hair. Those patients really should, or those kids or adults should really be wearing a hat when you can, because it
Yeah.
is hard to apply sunblock there. So hats, sunglasses, those can be
Yep.
helpful.
Yep. Anybody else before we let Dr. Seedor go? I think this has been really wonderful, and it's really exciting to hear about all the different things going on, especially with the vaccine and the AI stuff. It's really cool. It's really neat to hear all the progress that's being made and coming up. Um, yes, and thank you, Mackenzie. We have a brief survey in the chat as well. If anybody is able to do that, that would be wonderful. Um, Thank you, thank you, thank you. And we'll send this out to everybody that registered. Like we said, we have it recorded. Dr. Seedor was nice enough to share her contact information. So thank you everybody for joining us. Thank you so much. Wonderful information. And we'll see you for our next one this Wednesday. Bye, everybody. Thank you.